Hi, this is Dr.Jou. I'm a natural medicine practitioner working in South Korea. I am taking care of many difficult symptoms, difficult diseases, and angina is one of the diseases that I take care of on everyday basis. And there are a good number of patients suffering from angina, chest pains, and other cardiovascular disease. And I just want to express my opinion about how to take care of the angina by natural medical protocols. As you know well, there are many people who have the symptom of angina. The symptoms of angina or pathology or pathophysiology or the medical treatment is now well known among the angina patients, so I just want to skip over the symptoms, the varieties of the disease, and the medical treatments. As you know well, the medical treatments include the prescription drugs and the stent implementation and bypass surgery, and these are the typical medical treatments that is quite well known among patients with angina. However, on some occasions, some patients who have gone through these medical procedures still have some difficulties associated with the symptoms of angina, including the chest pains, the shortness of breath, and other symptoms as well. And this means that the modern medical procedures is not enough to completely relieve the symptoms of angina, and the patients, even though they have got the medical treatments, still have some problems, still have some difficulties in their everyday activities, or they have to take serious cautions in their everyday actions, in their behaviors, in their eating habits, or something like that. So we just like to provide natural cares and natural protocols for those people who still have some symptoms of angina. So I just like to say that through thousands of years in the Eastern society, including the China, Korea, Japan, and in other countries as well, the Eastern medical protocols or herbal protocols has been quite popular in Eastern countries. And these natural medical cares have been handed down to natural medicine practitioners just like me, and they also are very effective in relieving the symptoms of angina. And if the angina patients have some problems after they got the medical treatments, these natural medical protocols can help them remove some of the symptoms of angina, as well as restore their normal functions of the heart muscles and coronary arteries. So I just like to help our angina patients with these protocols. And in getting the natural medical treatments, we provide the herbal formulas and the acupuncture therapies and other natural cares for angina patients. And at the same time, when we look at the Western society has also a lot of natural medical protocols or holistic protocols for the angina patients, and they also have been effective in relieving some symptoms of their angina-related problems. There are many discoveries that has been made in the Western society in regard to the pathology or physiology of the angina, and many natural nutritional supplements have been popular in Western society in regard to the removal of the symptoms of angina. I have worked with natural medicine which has been discovered in Western society for more than several years. So what I just want to say is that I just like to incorporate the Eastern natural medical protocols and the Western natural medical protocols into one healing program in order to get the optimal outcomes for those patients with angina. So from now on, I just want to explore some of the things which is quite interesting to learn from the viewpoint of the natural medicine, and which is quite helpful for those people with angina in terms of the natural protocols and natural medical procedures. There are also a great number of medical protocols and Eastern medical protocols in Eastern society, but I just like to mention some of the most typical and most important things which is included in the Eastern medical procedure. And at the same time, I just want to express one of the most important things in the Western Natural Medical Society, and I just like to incorporate these two protocols into one healing program, as I said, and this will be exactly what I just want to use to take care of my patients with angina problems. First of all, the Eastern medical procedures has a great number of procedures, protocols, and herbal formulas, and the acupuncture therapies. But throughout a long period of time, while I worked with angina patients, I would like to express the most important thing which is quite helpful in understanding the angina, and that is the abdominal imaging and abdominal diagnostic imaging. This abdominal diagnostic image has been studied by many Eastern medical practitioners, and I just like to use this abdominal diagnostic imaging as one of the most important clues or important pathophysiology with which we are able to approach the fundamental and the root causes of the angina. And the other thing that is quite popular in Western society is the hair mineral test, as far as I know. There are also many types of protocols, many types of nutritional supplements and natural therapies available in the world. However, the hair mineral test and hair toxicity test would be one of the most outstanding procedures with which we are able to understand the fundamental causes of the disease. The interpretation of the hair mineral test is one of the very tricky things for us to do, and Dr. Paul Eck and Dr. Wilson is really the pioneers in the world of interpretation of the hair mineral test, and I would say they are really pioneers and genuine workers, researchers around the world who has been quite ahead of the times in the interpretation of the hair mineral test. So I just like to introduce you to one of my patients who has been working with me to be free from the problem of chest pains associated with angina, and who have been successfully working with me, and as a result, we have been able to remove and reverse the problem of angina almost completely. And the conventional medical diagnostic procedures, which have been done recently, proved that the angina no longer exists in the body of our patients. The cardiovascular system of our patient have been fully recovered, so there is no problem associated with the cardiovascular disease, including angina. So now let me introduce. We need to approach the problem basically on the fundamental pathologies. In order to do so, we need to approach how to come near to the root pathology of the disease, and in order to do that, we need to evaluate, as I said just before, the abdominal screening image. This abdominal screening image is a specific representation of the pathologies associated with the Eastern medicine. As you know well, the Chinese medicine or Eastern medicine or Korean medicine or something like that has been popular in Eastern society for more than thousands of years, so they are used very frequently and very often in relieving many difficult cases of patients. And in the case of angina and cardiovascular disease, we also need the Eastern type of screening tests. And this screening test is specifically designed for the angina patients, and in approaching the Eastern philosophies or Eastern principles of the pathology, this is very effective. Now let me explain some of the things associated with the this abdominal screening test. And now this is the torso or trunk of the patient's body, and we need to evaluate the length of the length in the chest area and the length in the pelvic area. The length of the chest area is much larger than the length of the pelvic area, and this indicates that the patient have the strong or yang energy. In this case, we need to some herbal formulas that is effective in reducing the strong or yang energy and reinforcing the energy, and then the balance between the yang energy and energy will be restored, and then the patient will feel much better. This is the principles and the basic philosophies of the Eastern medicine, which has been popular in Eastern society for a long time. And now let me explain some of the things on this area, and this indicates some tenderness in the lower abdomen. What do you think this means? Well, this indicates that there is a toxicity in the patient's body, because this tenderness and this strong sensation indicates some of the existences of the toxicities in the patient's body, and we firmly believe that these toxicities have something to do with the development of the pathology of the angina. So we need to remove toxins from his bodies, and this is the basic plans and strategies we need to work with the patients of angina. Now let me explain some of the things associated with the hair mineral test, because the hair mineral test tells us very detailed information as to what type of toxicities there are in the patient's body. Now this is the image or hair mineral test results, which represent some of the things associated with the vitamins, minerals, and other nutrients which is present in the patient's tissues and bodies. And now let me explain the most specific values of the potassium. The potassium value is out of the normal range. It is much higher than the normal range, and the normal value is indicated by these bars, and the allowed range is indicated by this area, which is represented by the purple color. And what outstands most is the potassium value. What do you think is something to do with the development of angina? Well, this means that the patient have the overactive sympathetic nervous system. The potassium has the function of the reinforcing the active energies of the sympathetic nervous system. So the higher value of the potassium indicates that the patient have too much activities or performances of the sympathetic nervous system, which indicates that the patient have tendencies of narrowing his arteries, including the coronary arteries. This means that the coronary arteries may be influenced by the overactivity of the sympathetic nervous system, which is indicated by the higher value of potassium, and we have to normalize the balance between the sympathetic and parasympathetic nervous system by analyzing these hair mineral charts. Well, this is a very important important principle and very important lesson which we can learn from this hair mineral chart, and we need to strengthen his parasympathetic nervous system in order to reduce the high values of this potassium, which means the overactive sympathetic nervous system. In order to do that, we need to encourage our patient to stop eating some caffeine, some sugars, some sweeteners, and other sympathetic nervous system stimulants. Caffeine, as you know well, is the stimulant for the sympathetic nervous system, so they have to be removed from his dining table as much as possible, and sugar is almost identical to the caffeine in terms of the stimulation of the sympathetic nervous system. So these foods have to be removed from his eating habits, and we have to provide enough amount of fats and oils, because the fats and oils have the function of reducing the values of the potassium as well as strengthening the parasympathetic nervous system, and then the balance between the parasympathetic and sympathetic nervous system can be done by this procedure, and this is one of the most important things we can provide for our patients. Now let me explain another part of the Herminor test, and which is associated with the existences of the toxicities of heavy metals. Now let me see the value of the mercury. The value of the mercury is much more higher than the normal values. What do you think the normal values of these toxicities? Well, these are the heavy metals. If they have any bars which is apparent, then this means that there is too much existence of the toxicities of these values. So this means that the patient have some amount of arsenic in his body, and this may have something to do with the development of the pathology of the angina. What is most outstanding is the value of the mercury. As you know well, the mercury have very catastrophic events on the normal functions of our bodies. So the high value of mercury, we believe, have a strong indication that the pathology of the angina certainly comes from the existence of the mercury toxicity. So we need to remove mercury from the patient's body as much as possible, and this is the one of the powerful plans for us to provide for our patients. In order to do that, we have to remove tuna or salmon as much as possible from the table of our patients. Because the tuna and salmon, the large fishes, have a high amount of mercury in his body, which has been accumulated by eating the smaller and the tiny fishes. For this reason, the salmon and tuna and other large fishes have the strong possibility that they may high amount of mercury in his body. So we have to encourage our patients to keep themselves from eating any type of large fishes, and this is the most powerful plants that have a great effect on the normal functions of the cardiovascular system of the patient's body. So as a conclusion, we can say that we incorporate many type of principles which is quite popular in Eastern society, and the reinforcing the energy, yin energy, and removing the yang energy may be the most important principle we need to apply for our patients. And then we need to balance the powers and forces of the parasympathetic and sympathetic nervous system, and this is the second most important part of our program for our patients. As I said, in order to do that, we need to provide enough amount of fats and oils for our patients, and the most favorable and most advantageous fats and oils which are popular in the market is the olive oil, and the milk butter is also recommended for our patients, because the milk butter and the olive oil and the omega-3 oil is very beneficial for the pathology and biochemistry of the patients with angina, so they are strongly recommended by our program. So we encourage our patients to eat at every meal 2 spoonfuls of olive oil and 2 spoonfuls of milk of cow butter, because they are beneficial to normalizing the nervous systems of the patient of them. And at the same time, we have to remove the mercury toxicities from the patient's body as much as possible. And as we said, we have to encourage our patients to shift their eating habits from raw fishes to the land fishes, land animals. For example, the beefs and the lambs and the chicken as examples of the land animals. They are very strongly recommended by our program, and the raw fishes, and especially the large fishes, are strongly prohibited by our programs for the normalization of our patient's body. And the small fishes, such as anchovy and such as sardines, are recommended strongly by our program, because the sardines and anchovy are not supposed to have any large amount of mercury in their body, because they only live for a short period of time for their life, and they does not eat other fishes, and they usually feed on the plankton for their lives, so they have a much lower possibility that they may have a high amount of mercuries in their bodies. So these are the programs, and these are the recommendations for our clients, and we only provide some of the herbal formulas for the patients of angina for the purpose of reinforcing immune energy, and we also provide some nutritional nutritional supplements for our patients, and they usually feel much better as they worked with us for their angina problem and angina symptoms, and they will feel gradually relieved and feel much better and healthier as they work with us for more than a month, or on some rare occasions they have to work with us for more than 1 or 2 years for the removal or reversal of the coronary artery disease. And most of the patients who have worked with us for this natural program, most of the patients feel much better as they work with us for some period of time, and this is very good news, we are sure, to the patients with angina, and especially for those persons who have been suffering the difficulties associated with angina for a long period of time, even though they have gone through the medical procedures which is provided by the conventional medical procedures. We are sure the natural medicine and the natural protocols will work very well for the patients of angina without exception. Thank you very much. We are working in Seoul in South Korea, and we have practiced the Eastern medicine and natural medicine for more than 35 years, so we are sure that we can help many patients with angina. Thank you.